we have to keep things in perspective. A little rebound COVID versus death, there's no comparison. We've come a long way.
And to your point, we do have to stay on top of it, considering how deadly it was and can be. President Joe Biden tested positive for COVID again. According to the president's doctor, it's what's called a COVID rebound after taking the antiviral medication Paxlovid. I want to bring in Dr. Frita Fisher. Dr. Frita, good to see you. How common of an occurrence is this? I remember when Dr. Anthony Fauci went through this as well.
Well, with that antiviral Paxlovid, Susan, it is common. They saw it in the studies that approximately 1.5% of patients taking Paxlovid did get a rebound in COVID symptoms. Usually about 4 to 5 days after completing it, they could test negative, but then test positive again and have symptoms. The good thing is that there's a rebound COVID is usually not serious, doesn't cause hospitalization or death, something to be expected. That being said, now that we have the BA.5 variant, it may be even more common than what we saw in the study.
And it's designed, doctor, to avoid hospitalizations and only given to those who may be at a higher risk here. So the positives, it appears, outweigh the negatives.
Absolutely. Paxlovid is an antiviral drug. It's a 5-day course, 3 pills twice a day, and studies show that it reduces hospitalizations and deaths by 89%. And of course, our president is 79 years old, at high risk. And so I'd much rather have some rather benign rebound COVID symptoms than to be hospitalized or be dealing with death. So definitely the benefits outweigh the risks.
And President Biden releasing a statement saying, look, I feel okay, I don't have symptoms, but of course, testing all the time and testing positive. Does that mean, doctor, do they know this at this point, if he went out and caught it again, or if you could just be at home alone and it comes back because of the medication?
It's because of the medication. It's rebound. And of course, we know he's been quite isolated, wearing properly tightly fitted masks. And so it's simply the rebound symptoms from the original COVID infection. I do still say the benefits outweigh the risks. And so people are eligible for Paxlovid if you are at least 12 years old, weigh 88 pounds, and if you are at high risk, meaning if you're elderly or immunocompromised. So certainly, I still do think it's a great drug. You have to consult with your physician.
And just listening to you, we have come so far, haven't we, since 2020, not only with the vaccines, but also having this antiviral drug available.
Exactly. And sometimes we forget, Susan, back when there was the Delta variant or when there was the original wild type, people were dying. Like if you got COVID-19 and you were elderly, it was almost guaranteed that you would be in a hospital or on a ventilator, and death was imminent. Now you can be elderly, and especially if you have had your 4 doses, meaning that you've had your full vaccine series plus your 2 boosters, then you're very, very protected from dying. And so we have to keep things in perspective. A little rebound COVID versus death, there's no comparison. We've come a long way.
And to your point, we do have to stay on top of it, considering how deadly it was and can be. Dr. Frita Fisher, thank you.
Thank you.